These next two lectures, the chapters 3 and 4, are going to be covering the first 2 years of life. Chapter 3 deals specifically with the first 2 years in terms of the body and brain development, whereas the chapter 4 covers the first 2 years psychosocial development. So in this lecture, we'll be talking about the brain and body development first. So when we talk about normal and abnormal growth, the first thing that we have to do is have a sense of what normal is. And normal is difficult to define, but the typical way that we go about defining what normal is we look at what is the case for the majority of people. And these are usually referred to as norms. Okay, norms are an average measurement. So if you have 100 or 1,000 newborns, what does the average newborn tend to weigh, or what is the average length of a newborn? And then the further that one deviates from that average or from that norm, the more it suggests that there may be a problem or an abnormality in development. So when we look at the norms for weight and length in the United States, or in North America more specifically, the average weight is about 7.5 pounds and the average length is about 20 inches. So the first thing that we're looking at when an infant is born is are they within a range that is close to these norms in terms of weight and length. Now, it's normal for infants to lose some weight very early on. And one of the ways that we're going to track the progress of development is, of course, to have these checkups, these well baby checkups, to make sure that growth is occurring at the expected trajectory. So a doctor or nurse will measure a baby's growth, which includes usually at least the height, weight, and head circumference. The head circumference is particularly important because we want to make sure that the brain is growing normally in addition to the rest of the body, which is usually going to be indicated more by the height and weight. Abnormal growth may indicate physical or psychological problems. The psychological problems will typically be a result of abnormal brain growth, although it's interesting that both environmental physical factors and environmental psychological factors both will contribute to the way that growth occurs. What I mean by psychological factors, an infant that gets all the physical caring that it needs without any of the emotional caring will not develop normally. That's what I mean by that. But one of the protective mechanisms that's interesting to see in infants is this term called head sparing. This is a biological mechanism that protects the brain when malnutrition disrupts body growth. The brain is the last part of the body to be damaged by malnutrition, and again, this is a protective mechanism. If in the cases of malnutrition, now this is going to be less so the case in developed countries than it is in underdeveloped countries. But regardless, when there's a lack of nutrition or malnutrition, the brain will take in more of its caloric needs and nutritional needs as opposed to the rest of the body that will get less of those things. And again, that's a protective mechanism to ensure that the brain keeps growing normally. Here's another interesting fact about development in the first couple of years. If you look at the percentage of adult size that different norms are relative to adult size, we see that brain weight is about 75% of what it will be in an adult within in the first 2 years. Whereas in terms of height, at 2 years old, you'll only be about 50% of how tall you'll be as an adult. And in terms of weight, you'll be less than a quarter. Your weight will be less than a quarter of what it will be as an adult. So it's interesting to see that our brain is developing at a much faster rate than the rest of our body, which can be measured using these other two measurements here, height and weight. So again, we see very different changes taking place in the brain than we do in the rest of the body. Now here's a look at your basic neuron, or two neurons in this case. One neuron here, neuron A, one neuron here, neuron B. The growth that we see in the brain is primarily not so much the development of these neurons here, these cell bodies, okay, but more so a development of these structures located off of the cell body, coming off of the cell body here, dendrites, and these structures here, axons. Okay, so this is the cell body, these are the dendrites, and this is an axon coming off of a neuron. Those are the three basic parts of a neuron: cell body, dendrites, and axon. And the way that neural communication takes place, neural communication being the communication between one neuron and another neuron, keeping in mind that we've got billions of neurons in our brains. Neural messages are detected by these structures here, the dendrites, in the form of a chemical impulse. So chemicals attached to dendrites, they cause an electrical signal to travel through the dendrite into the cell body and then down the axon. So this is the way that that neural coding takes place. It comes in through dendrites, goes through the cell body, and exits out through the axon to send that message on to another neuron. And when that electrical signal gets to the end of the axon here, it releases chemicals called neurotransmitters, which again will be released onto the dendrites, primarily the dendrites of other neurons. So most of the brain growth occurs because of increases in the number of dendrites on neurons and increases in this coating right here that you can see called a myelin sheath. Okay, this coating on the axon called a myelin sheath is responsible for increasing the velocity of the signal. In other words, it makes it go from here to here much faster. So if we zoom in here, we see that the end of this axon here is releasing these chemical neurotransmitters here, and they're attaching to receptor sites on the dendrites of neuron B, and then that process will continue. So again, I just want to highlight that neurons and synapses proliferate before birth. Okay, we have more neurons at about 8.5 months after conception than we do at birth. Okay, so neurons are being generated at a tremendous rate before birth, and then we generally, although we do develop new neurons after birth, that really pales in comparison to the number of new synapses and new dendrites and new coatings on the axon that will develop. So this increase continues at a fast pace after birth, but interestingly enough, soon an opposite phenomenon occurs where you have the elimination or pruning of unnecessary connections. So the term is typically used, pruning, to describe this process where unnecessary connections are eliminated. And what determines whether a connection is unnecessary or not? Well, it has to do with whether that brain region is being utilized. So all of our environmental experiences in the first few years of life determine what areas of our brain are going to get used. Okay, and we'll talk about some of the areas that specialize in certain things of our brain. But the last part of the brain to develop and mature is the prefrontal cortex. Okay, this is an area that's involved in the most complex things that really differentiate humans from all other species. Our ability to anticipate things in the future, our ability to plan things, and our ability to inhibit or control our impulses. In other words, we are not just our behavior is not governed solely by stimuli in our environment. What I mean by that is that when we are presented with a stimulus, say we see a nice tempting dessert in front of us, we don't just go and eat that dessert because we may be hungry, but we may be on a health kick where we don't want to eat unhealthy foods. So we choose not to eat that tempting dessert, even though we may be very tempted to. Um, damage can occur in the brain for a variety of reasons, part of which we mentioned previously in terms of exposure to teratogens. But postnatally, one of the most preventable types of injury to the brain is a result of shaken baby syndrome. This is a life-threatening injury that occurs when an infant is forcefully shaken back and forth, a motion that ruptures blood vessels in the brain and breaks neural connections. Okay, our brains are particularly sensitive very early on because of the way that they're developing, and so smaller injuries are capable of producing larger, or I should say, uh, um, less traumatic injuries are capable of producing more serious injuries in infancy. Newborns sleep about 17 hours a day in 1 to 3 hour segments. So part of the reason that they sleep this large amount of time, okay, adults don't sleep anywhere near 17 hours a day. Maybe some of them wish that they do, but we're lucky if we can get about 7 or 8 hours. Usually it's probably closer to 6 hours during the week, particularly when we have things to do. Um, a lot of this sleep is taking place because it promotes brain development. Um, you may be familiar with different stages of sleep that adults go through. Newborns also go through different sleep stages. Particularly, most newborns spend their most amount of time in active sleep, where they're often dozing, able to awaken if someone rouses them, but also able to go back to sleep quickly if they wake up, cry, and are comforted. This active sleep is the equivalent of uh, REM sleep in humans. It's really just REM sleep in newborns as well. This is when they are engaging in those rapid eye movements. This is when adults will report they're dreaming if they're awoken during this REM stage of sleep. Of course, we can't ask infants if they've been dreaming. We assume that they are dreaming because we know that the same thing happens in adults, but without the ability to ask infants that question, we're really just making an assumption there. So they probably are dreaming, but we have no idea what their dreams would be like, especially without language development at this point. The other type of sleep is called quiet sleep. This is when there are slow brain waves and slow breathing. Um, Putting infants to sleep on their backs reduces the risk, although it doesn't eliminate it completely. There was the slogan "Putting infants back to sleep" to try to remind parents that infants should be put to sleep on their backs rather than their stomachs because of that reduced likelihood of SIDS occurring. So for every infant disease, including SIDS, another protective factor seems to be breastfeeding. Breastfeeding reduces the risk, um, whereas malnutrition increases the risk of SIDS, um, stunting growth of the body and brain. So breastfed babies, they're less likely to develop allergies, asthma, obesity, and heart disease. It seems that breastfeeding has just a large number of benefits above and beyond uh, any formula that has been developed. As the infant gets older, the composition even of breast milk even adjusts to the baby's changing nutritional needs. The recommendation is that